I wasn't the one with cancer, but my son had it and he could potentially die, and over my dead body, was I going to let that happen, right? I am so grateful to this guy. This is Noah. We're going to give you an update on his cancer journey. The cancer diagnosis he got, every single person we talked to said this is an aggressive cancer.
Serious aggressive
it's
cancer.
It's rare. We don't have a lot of information on it. In fact, when you went initially to the first oncologist, they were going, well, we don't really have a protocol for your cancer, so we're just going to use the regular colon cancer protocol.
But back in December of 2024, I was diagnosed with what we thought at the time to be colon cancer, and it uprooted our lives, quite frankly. And I really do mean our.
When you have a child diagnosed with a potentially fatal medical condition, you dive all in.
I've never felt more grateful for having a father like you and having the support of someone like you in my life. Many don't. It's a big deal. Thank you.
You're welcome.
So the quick summary was that I started having acute stomach distress, kind of like in the upper part of my abdomen, in early November of 2024.
Frustrated because the last 2 weeks since I think I have food poisoning, I've just got what feels like trapped gas permanently in my stomach when I eat. So it's just cramps and it hurts. And
this eventually led to me being put into the emergency room and hospitalized in the middle of December 2024, where between a colonoscopy and a CT scan and some blood work, it was discovered that I had a big tumor in my large intestine. They had initially thought maybe Crohn's disease. After that colonoscopy, they thought, no, this looks like a cancerous tumor based on their experience. I did a hemicolectomy surgery, which was removing a third of my large intestine, 10 inches or so of my small intestine, which included, I think it was called the ileum, and then my appendix did come out with this, by the way. Pretty bad pain situation was eventually managed. We got out of the hospital and we were put on a journey to figure out what to do about this appendix cancer. Stage 3C, I believe, with positive margins, meaning when they cut everything out of me, per lab testing, as valiant of an effort as they did, they couldn't literally get the entire blood supply to where everything on all the edges looked cancer-free, which is part of what perpetuated a lot of urgency, I think, in me and certainly in him as my dad and being as connected as he is and in the know as he is from the medical side of things to make decisions and make them quickly. A lot of consults, repurposed medications, lots of supplements, naturopathic doctors, Western medicine doctors, visits at local hospitals and specialty hospitals like OHSU as far as people that have experience with appendix cancer, and all things considered, chemotherapy did appear to be the one consistent bit of feedback we got. What I ended up doing was something known as insulin potentiated therapy, aka you might think of it as chemotherapy light. It's like doing chemotherapy in a way that promotes the use of chemotherapy agents at a lower dose, leveraging the dropping of your blood sugar to create a whole sensitive experience for chemo and cancer cells. We're not going to get into the science and the details of that. Again, link in the description if you really are curious. He's in a lot of these videos, if not damn near all of them, for the first 2 or 3 months. And then we came back. And when we came back, it was all about PET scans, which we did, which was clear. It was about Signatera ctDNA blood test monthly. Just think of a hypersensitive cancer test, which have all been clear. Lots of supplements, lots of protocols, lots of in-office treatments. Just waiting basically to see how did I respond to the chemo. And the latest update we have is that I wanted to take a moment to thank everyone who has supported my GoFundMe. But I couldn't have done these alternative treatments, the chemotherapy I did, the traveling to meet with different specialists, the advanced testing, and my weekly treatments at the Portland Clinic of Holistic Health without you guys supporting me. Thank you. My most recent tumor cell count went slightly up. Total cancer cells running around my blood but not sticking anywhere went ever so slightly up. But all the other tests have actually been quite positive, and all the other scans so far...
Negative, you mean?
Excuse me. I perceived them in a positive way.
Right.
But they have been negative in a good way. My naturopathic doctor sat down with me and said, okay, here's everything we're doing. Here's all the labs we have. Here's all the scans we've done. I want you to take them to the original OHSU here local doctor who specializes in appendix cancer and make sure we're all on the same page. And that same page, assuming we get a good couple blood tests that we're waiting on back, which I'll update on my channel, and a clear CAT scan, which I will do next week, they both believe I'm exhibiting formal no evidence of disease presentation. They wouldn't call it remission, but they would call it NED, which means, God willing, we just surveil like crazy. I stick to my nutrition plan that's carefully curated, like Ellie, sit down. Good Lord, that's
We are recording at home.
I just stick to my game plan that I talk about on my channel, and we pray for these good results, and then we just push ahead. That's the main update.
The real blessing in all of this is we have a mainstream local expert. OHSU is the Oregon Health Sciences University here in Portland, Oregon, where we live. And they are supportive of the choices Noah has made to pursue what others would consider alternative. Because so far it's worked. And the beautiful thing about insulin potentiated chemotherapy is done right, which I believe we went to the right place, Dr. Schallenberger in Carson City, Nevada. It's as good as chemotherapy.
Yeah,
I mean,
I believe
you
that
just
too.
get to use a lower dose so you have less side effects. One of the agents was exactly the agent that the mainstream docs would have used, and the other agent, based on the RGCC testing, was actually more potent against his specific cancer. So it's a brilliant approach. It's very individualized. It's really cutting edge, personalized medicine, and we're blessed to have access to these tools and this range of docs. And so there's your update. He is, at the moment, doing great.
Yeah.
No evidence of cancer.
Yeah, which is really hard for me to believe. And there's a whole emotional side of this we won't go into. It's all on my channel, but it's been a lot. And for whatever it's worth, I am not dogmatic about cancer treatments or the cancer experience or what's best for anyone. And I really believe in advocating for patients to be as informed as they can to make the best decision they think is right for them. Did it throw you off that I was given such a significant and serious diagnosis, or were you able to sort of compartmentalize emotions and still approach it like you would one of your patients growing up? I kind of am curious to hear what you'd say about that.
When it's your child, it's different.
Yeah.
I don't know if apology is the right word, but it hit me harder than the cancer in my patients. As a pediatrician, you don't see a lot of cancer. So I only have a handful of patients who had cancer in my practice over a 35-year career. And I would just refer them to the specialist, and I would support them emotionally to the best of my ability, which sometimes I don't think was as well as it could have been. I was certainly wanting to be as helpful as possible.
Yeah.
When it's my own son, it's like, whoa, what can we do? I remember realizing that with my patients who had cancer, they very quickly became more expertise, having much more knowledge than I had.
Right, because it's not your field.
It wasn't my field.
Yeah.
And what we experienced together, because I was with you for so many of the visits in the beginning, I became as knowledgeable as you were.
And then quite obviously more knowledgeable given your background.
A little maybe, but not much. I mean, we were learning together in a way that I wasn't able to do with my patients because I couldn't go with every patient to all their visits.
Yeah, he became like, I got the impression, pardon the interruption, that you were prepared to move heaven and earth to give me my shake at overcoming it. It was a very comforting, inspiring feeling that you were like, I don't know what's going to happen, but I believe in your wellness, and we will turn over every rock to give you a shot.
Let me speak to that. If you have a loved one who has a rough diagnosis, or they're in a situation where it's touch and go with their even survival, they need you or someone like you who's a loved one who really, really cares to take over.
Yeah.
Because it's too much.
It's paralyzing.
You are paralyzed. And I've been there personally when this may be a video in the future, but when I was losing my license, losing my practice, losing my research, losing my marriage, and everything at once falling apart, I reached a point where I couldn't process information clearly.
Yeah, that's a good one. That's a very real thing.
And you need someone that loves you and cares about you, that you can just turn it over and say, I need help. Yep, take over the decision making. And it's so much easier to make the decisions when you're not the one that's potentially dying.
Yeah.
Right? So in this case, I wasn't the one with cancer, but my son had it, and he could potentially die. And over my dead body. Too much dying here, was I going to let that happen, right? So I'm going to learn everything I possibly can. If you have a loved one for whom you can step into that role, who needs that role, then, and you can pull it off, do it. It's the biggest gift you can give someone.
Lord.
And it was a lovely journey. If you can call a cancer journey lovely. If you go to his channel, Big No No, you'll see we had a lot of fun with some of his suffering. And it's just part of life sometimes.
Yeah, it really is. Okay. I do believe I will be here for a time. I'm not the type to espouse that I think it's all over, nothing like that. But I do think I'm going to be here for a time. I feel safe to pursue things that matter to me again and all of those things. And you guys matter. You obviously matter. This channel is a blessing and it matters to us. And so we just want to get back to it, but we wanted to touch base on this first.
Yep. So here's the driving force.
Yeah, right.
And we're going to be here for you all.
Yeah. Take care. We'll see you guys in the next video. Really good stuff coming up. I hope you keep tabs on us.
Thanks for watching.
Adios.